All right. Welcome, everybody. So we are just allowing people to enter on our Zoom. Hi there. Welcome, Hannah. Thanks for joining us today. We're just having everybody join on this new secure platform here with a password and everything. So I'm just going to be taking the next few moments to let everybody join us live here. So like we said, Dr. Lisa, this is my mom. She's an amazing doctor, and she's going to be sharing with us today a bit about headaches and what she's seen to be really helpful throughout the years. And yeah, what have you kind of talked about it a little bit in the first one, but what have you kind of seen with headaches?
Well, what I see with headaches is they're complicated. They're not usually just one thing. They can be, but you can have structural reasons, car accidents, head dives when you're a kid off a swing. It can be food that you're eating. It can be inflammation that's going on. It can be cranial sacral issues, so you need some cranial work, maybe from birth trauma or even from, falling and car accidents. So I think that if you have a technique or a way of going at it multi-pronged, it's way better.
Mm-hmm.
Food, like I said, foods that you're eating, allergies can all contribute. So, being able to find a system that looks at it from many different angles, usually it'll give you better results.
Yep.
Than just trying one thing, like just massage or just getting acupuncture. I think sometimes, many ways of going at it are better.
Yeah, I think so too. And I think that's something that we do a lot at Health and Balance, is really looking for the root cause. We talk about the 4-system approach and how there's emotional, structural, electromagnetic, biochemical things that are behind our symptoms. So we really try and help to walk you through that analysis process to get to the bottom of it, of what's going on, what's the cause, and then fixing it from there. So we still have quite a few people that are going to be hopping on. Hopefully they got the new link. But let's just get going and starting on the PowerPoint here. Okay, so we have headaches. 5 keys to beating the pain. Okay, so what's going to help us to actually get rid of headache pain? So here's what we're going to go through today in our webinar. So we're going to talk about, number 1, a common ingredient in every headache according to the research. Number 2, 3 foods that are found to trigger headaches. Number 3, 5 nervous system nutrients that all headache sufferers should consume to help reduce inflammation and headache pain. Number 4, 3 simple lifestyle changes that will drop the risk of reoccurring headaches. And number 5, a link to a headache solution that most MDs are not talking about. Okay, so why am I here? So I'd love for any of you that are on with us today to just hop onto the little chat bar and just tell us why you're here. What are you looking for? What symptoms are you experiencing right now? And, what are you kind of hoping to glean out of this webinar? What are you hoping to learn? What's going on with you? Let's take it back to the real reason, okay? So just hop into that chat bar real quick and just share a little bit with what's going on with you. All right. Okay. Awesome. So we're kind of looking at why we're experiencing headaches. If you want to chat on Facebook Live, you can also just type in, what you're looking to glean from this webinar and what your symptoms are at this point. So let's get into that. Why are we experiencing headaches? What's going on? What's the reason for this? So, all right, there's different types of headaches. So this is going to get into the cause. So why don't you share with us the types?
So we've got sinus headache, which is pain behind your brow bone or cheekbones. And obviously that's from sinuses being clogged, from allergies, from some sort of microbe that you might have in your sinuses that they find that you're a great host. And so that's something that we can look at. We can look at allergies. And if you've got some sort of microbe that's growing in there for some sort of reason. Cluster is pain behind one eye. And that a lot of times comes from muscles being too tight in your neck. Also with tension headache too, muscles being too tight in your neck. The band is like a band squeezing your head. And migraines, of course, we all know are pain, nausea, and visual changes that are typical in that classic form. So those are the 4 basic ones.
Mm-hmm. Yep.
And then what do I do? With all the information out there, it's hard to know what to do and how to do it. And we know that, that a baby's formed at 6 weeks and we have this miracle of life, and that, we are born to be healthy. We have differentiating tissues and that our body heals.
Mm-hmm. So how does our body heal?
So we know that when we have a cut, miraculously in 6 to 10 days, that cut is completely healed. And same thing with a cast. Is the cast that healed you? Well, the cast immobilized you so that you could heal. So we all know that we heal from within, and that our bodies are amazingly built. And that's how we feel about with headaches as well, is that if we could figure out what is the main cause of that headache, that if we take those disturbing factors away, they're like straws on a camel's back. Let's figure out what those straws are. Let's take those straws away, and then your body can go back to being healthy and well.
Mm-hmm. Yeah, that's good.
So the nervous system is the perception and control center for the head, neck, and body. And the function of the nervous system is to perceive the environment and coordinate the behavior of all other cells. So in our nervous system, we have the parasympathetic and the autonomic. And basically the autonomic does everything automatically. That's how your heart beats, and that's how you breathe. And then we also have the flight or fight, or the rest and relax part of our nervous system. And if we have too much flight or fight, that clamps down on all your nerves and your muscles. And then if we have the rest and relax, is what we do in the evening when we sleep and we kind of calm down. That's really important for restoration and healing of your body. So if you don't have a balance in those 2 systems, you're not going to heal. And so that's really one thing about, finding out where you are, the stresses in your life, to remove them so that you can rest and relax. And the stress can be scar tissue, for instance. A vertebra out of place can be something that can contribute to flight or fight.
Yeah. Good. Okay. So
rest dominant versus flight dominant. So where are you in this kind of like balance? Are you in flight or fight and survival mode? I mean, we all know that right now, so many of us are kind of a little bit from our situation in the world. We can be kind of over on that tilt in flight or fight because it's a little scary right now.
Yeah.
And so you have to balance that kind of where the world is right now with figuring out for you how you can put yourself more in parasympathetic mode of rest, restoration, relax, feeding your system.
Good. All right. So
the 5 ways to reduce headache pain by supporting the function in your nervous system is avoiding these 3 foods, which we'll talk about, consume these 5 nervous system nutrients, which we'll talk about, sweat, moving your body, exercising, walking, going out to the beach and walking and getting your feet on the sand and connecting yourself to the earth, sleep, and spinal health.
Sweet. All right. So we're going to get to the nitty gritty. These are the good things you can do.
So these are so easy. And most of you all know this, avoiding these 3 foods. Sugars come in so many different forms. I mean, you got to really read your labels. I think that's the bottom line. And you all know, if you go to Starbucks and you get one of those sweetened drinks, they're filled with sugars. Everybody knows that. But also I think it is super important to read your labels and stay away from high fructose corn syrup. I mean, that's really easy to do, by reading your labels. Artificial sweeteners, Splenda, sweet and low, high fructose corn syrup, all of those things are in, those can be hidden in things. So getting better at reading your labels. And even I find myself, maybe I will have bought something for a while and then I decide I'm going to look at the label, and then I read the label. I'm like, oh my gosh, I cannot even believe that this was in here and I've been buying it. So I think that we all could get better at taking just a little bit more time at reading our labels. And hydrogenated oils, and they're not really in too many things anymore, but for instance, canola oil is most of the time grown in not a very healthy environment. And I think if everyone can just stay away from canola oil, and for instance, going to Trader Joe's, you pick up one of the marinara sauces and you look at it and it's like, oh, The oil in there is canola oil. It's not olive oil. And so that's an easy thing to change is to find your things that are made with olive oil instead of canola oil. So not all oils are hydrogenated, but it will say hydrogenated oil on there. But soybean oil is another one to stay away from because most of it, unless it's organic, it is grown in soil that has been treated with Roundup or glyphosate. Same with corn oil. So those things are good to stay away from and stick with your olive oil if you can.
Yep. It's good. And I like that. It's so true. I mean, sometimes even things that say like natural and healthy, you know, it's like you think that they might be all clear, but then there could be like this hidden stuff in there. So we really have to
read our labels.
Read the labels. Okay, so now what can we add? What can we add into our diet to help decrease our the inflammation and headache?
Well, healthy greens, you know, healthy fats, like we just talked about, unhealthy fats. So let's talk about the healthy fats. Avocados, coconut oil, olive oil are really good. I think nuts, like macadamia nuts, are really great.
Yeah.
I think omega 3s are the healthiest fats to add. And a lot of times what I find, and this is one test that we do in here, it's such a great test, and we can send you home with this little kit. You can take it home, you can prick your finger, send it off. I think it's $120, and it will come back and it will let you know how your omega-6 fats are in balance with your omega-3s. And omega-3s are walnuts, fish oils, thank you. And there's not very many foods that have omega-3s. So we a lot of times have this unbalance between our omega-6s, our omega-9s, and our omega-3s. So, but these are healthy fats to add. Healthy protein, cage-free eggs, wild fish, grass-fed beef. And you really have to look for those because they're not easy to find. High fiber foods, more vegetables, moderate fruit, and then water. Water is so important, and the way that I think the best way to do it is to take your weight, cut it in half. That's how many ounces you should drink. So I'm 130, so I'm going to be doing 65, 70 ounces of water a day. And I think it's great to get a Hydro Flask.
Yes.
Because then it's got the ounces right in there. So I have a 40-ounce Hydro Flask. I try to drink 2 of them a day.
That's really good.
And if you're drinking coffee, should add a little bit more water. Yep.
And drinking like throughout the day. So you want to be drinking like every 20 minutes, right? Because your body only absorbs a certain amount. So you don't want to just like drink your whole Hydro Flask at one time.
No.
I did it. I drank my water for the day. Your body's only going to absorb a few ounces of that because your kidneys can't process it all. So really like set a timer, 20 minutes or every 30 minutes. And
have that water bottle always with you.
Yeah.
Yep.
Okay, and then move your body.
Move your body. Now, I don't necessarily agree with this that walking's good. I think walking's great.
Okay. Walking is great.
I think walking is great. And I think that for me being 61, I walk a lot more now than what I used to. I mean, I used to run, but running's not good for me right now.
Yeah.
Running is actually not a good sport for me. Yeah. So I think it depends on your age, your ability, what is best for you. I do think everybody should do a little bit of resistance work, whether it's bands, whether it's weights, whether it's your own body weight. So we all know this.
Yeah. Keep moving. It's so important for circulation, for lymphatic drainage. Sweating is so important for detoxing. So a lot of times, I mean, and one type of headache is a toxic headache. So you might have a buildup of toxins in your body, and if you're not processing through those well, that's where your headache could be coming from. So
very true.
Moving can help with that as well.
Sleep is very important. I think it's underrated in our high go society, and 7 to 9 hours a night. And I think that tip of focusing on bedtime is really important.
Super important.
And especially for teenagers and children, that's such a good tip. And our better sleep is before midnight. It just is.
Yeah.
So if you can get to sleep the earlier before midnight, the better. Maybe just wake up earlier.
Yeah.
Get your 7 or 8 hours, 9 hours of sleep, and go to bed at 9:30. Go with the sun.
There you go. Going with the sun.
Going with the sun. Yeah.
Good thing.
Yeah.
And starting to staying consistent on your schedule. So you're going to sleep similar times every night and waking up similar times helps your whole rhythm. And we have a lot of really good sleep tips, but that's another topic.
So your spine and nervous system, spinal alignment, the brain requires feedback from the spine through proper alignment and movement in order to deliver the right information to all muscles, organs, and tissues. I just want to say a little something about that. You have 33 bones in your spine.
Wow.
33. So if I just want to do a little visualization, if everyone closes their eyes, and if you put one arm out to the side and point your pointer finger, when you bring your finger in to touch your nose, you can touch the tip of your nose, correct?
Mm-hmm.
Because you know from the proprioception in every single joint where your nose is, where your eyes are. So that's called proprioception, when you close your eyes and you know where your body is in space. You know that where you're sitting, you know what you're sitting on, because even though your eyes are closed, that's called proprioception. Now, imagine a vertebra. Okay, so I'm going to pretend I'm a vertebra. Here I am, this vertebra. Okay, my body's the body of the vertebra. My arms are the little pokey outy things on the vertebra that all the ligaments and joints attach to. Okay, so here I am, this vertebra. Let's say I get into a car accident. Okay, and all of a sudden that car accident whips me backwards, and my head was a little bit turned. So now this vertebra gets kind of whipped backwards, and then comes forward and rebounds and kind of gets stuck to the side, okay? So I get stuck to the side from all this scar tissue from that really intense car accident I had. Well, what's happened now that I'm stuck to the side is that all the proprioception back and forth to the brain is now aberrant. It's not normal, it's aberrant. And so let's say for 20 years, you have aberrant messaging going up and down your spinal cord to your brain. That's not a small thing, that's a big thing. So you do have 33 vertebrae, and they need to be aligned and they need to be in balance so that all that information that's running up and down your spinal cord to your brain is healthy. So that's important. My mentor taught me that, and I thought, wow, that is a big thing.
That is a big thing.
So trauma to our spinal cord doesn't necessarily always just fix itself. And I think that is one thing that's really important from this slide.
Yeah. Oh, this is a cool group exercise. So this is if basically showing you how important your like neck positioning is. So if you guys all, sit up straight or stand up straight, put your hands right in your low back.
Small of your back.
The small of your back. So right here, okay? So you want your head to be normal. And then as you have your thumbs in the small of your back, push your head forward, losing that curve. So you want to really push the head straight forward. And you'll feel the muscles in your low back tighten up, tense up. And you realize that our spine alignment with all the natural curves is made so perfectly to handle gravity, to hold up our head, to hold up our bodies. But when that's out of alignment, we have poor posture, whether the head's forward or we lack curvature in the neck or in the low back, whatever different postural distortions we have, they make such an impact on our body and on our muscles. Our back muscles tense up. So that's a really interesting exercise. Just you can physically feel the effects of postural distortions. All right, so why is the spine so important?
Well, the spine protects and directs our nervous system. So our spine is a covering for our bony structure of our vertebra is for our spinal cord. It is protection. And, and I mean, they're showing Christopher Reeves who, broke his upper cervical vertebra and then he damaged his spinal cord. And so we know that the spine is so important for that protection. And when our spine is out of alignment, I mean, let's talk about sciatica. Everybody knows what sciatica is, right? We know it's pressure on a nerve. And what happens with sciatica is pain goes down our leg. It's the same thing in our cervical spine. If we have pressure on a nerve root, on a nerve, we're going to have pain. And that pain can go different places. It can go up behind our eye. It can go up into our head. It can go down into our shoulder. So when you've got these radiating nerve pains, that's coming from some spinal nerve root. So that's where our is protection, and that's also when it moves and is out of alignment, we can feel it.
Yeah, it's so true. It's crazy how important it is. Okay, they're just pointing to the spinal cord. All right, so this quote is super cool. The spine and posture affect and moderate every physiologic function from breathing to hormone production.
Yep.
That's one of the reasons why the spine is so important.
So physical stresses, we know sitting, and a lot of people have been sitting more. They say sitting is the new smoking. Sitting at our desks, our kids are doing more computer work, and you can look at that posture of that person sitting. And I know we all felt ourselves start to do that. And as Maria said, when our head, which weighs 8 pounds, goes forward, it does put stress all the way down into our low back.
Mm-hmm.
Obviously our shoulders, obviously our neck.
Mm-hmm.
And so I think it's a really good practice for people that do work at the computer to get up every 20 minutes and spend 5 minutes walking, stretching, breathing,
Mm-hmm.
doing some things to just offset that sitting.
Yep.
So tech, it says extensive cell phone use and posture cause changes consistent with the age spine, but are now being found in younger age groups. And I have found that as a chiropractor, I see, we take x-rays of all aged people just that have neck pain or low back pain, and we can see that their spines are aging at a definitely faster rate. And not only tech does that, but also accidents age our spine as well.
Mm-hmm.
And birth trauma often causes neurological dysfunction. In fact, a study estimating more than 1,000 infants concluded that approximately 80% had some form of nerve dysfunction.
Mm.
And that is really true. And I think adjusting infants is something that, there's some really good pediatric chiropractors out there.
Yeah.
And Dr. Jordan is one of them.
Mm-hmm.
Yes, who works here at the clinic. So that is always something to consider to get your youngster checked out if there was any sort of birth trauma or a hard birth.
Mm-hmm. So good.
So chiropractors talk about subluxation, which is an interference in the brain and nervous system from a spinal vertebra not aligned or moving properly. And that's kind of the little demonstration that I did earlier, is that you have these 33 bones going down your spine, covering up your spinal cord, and out of each vertebra, a pair of spinal nerves comes out. So you've got, spinal nerves on each side. And so you have a vertebra above, a vertebra below, and then you have those spinal nerves coming out. And if there's tension, twisting, pulling, compression on those spinal nerves, you're going to feel it.
Yep. Mm-hmm. Subluxation is no good.
And when your spine is out of alignment, your nervous system releases more stress and inflammatory hormones into the blood and body, aka the bear stays in the room.
Mm-hmm. That bear's there causing stress. So what does that bear do to our bodies?
So if a bear was in a room, do you think your body could fully focus on, let's say, just proper digestion, or quality sleep, or blood pressure, hormone balance, and healing? So you can have all the best nutrition, exercise, and sleep. You can have all the best, but if you are subluxated, aka the bear's in the room, you're going to have symptoms from that. And so those symptoms could be a lack of nutrient absorption. It could be that you have ineffective exercise or poor sleep. And I say one of the biggest things is that people do come in and say, when I'm moving, I feel my hip catch, or when I'm, playing basketball, I feel this catch in my arm. And so most of us can feel that ineffective exercise. We can feel when, our muscles aren't moving fluidly and equally on both sides. But a lot of times we don't think that, wow, maybe my lack of nutrition or my lack of absorption or my gut health could be coming from my spine. And so that's one thing in here, and with this presentation, is you got to think that those spinal nerves are going to your digestive organs, and those spinal nerves are going to your adrenal glands, which are so intertwined with your pineal gland for sleep.
Yeah. Wow. So interconnected. I love the graph that we have, where each vertebrae goes to the different organ systems, because you realize how connected that vertebra is to the rest of our body and our spine. So the research behind this. So there's a 2006 study that showed a change in vagus nerve, which is known as the CEO of calm in the body. So just kind of showing how the spine really is connected to like calming our system. And then a 2017 study which utilized a PET scan to show an inhibition in the stressed sympathetic tone of the nervous system. So basically, creating more stress when we have those subluxations.
So I just want to say something about the vagus nerve. So the vagus nerve is a cranial nerve, which means it originates in your brain and then it travels down through your spine. So there's ways that you can affect the vagus nerve by adjustments. You can also affect the vagus nerve by craniosacral work as well.
Cool.
Yes.
So this is the one thing that we talked about, that there's one thing that a lot of MDs and a lot of doctors aren't talking about in terms of headaches and migraines. And it's that research has astoundingly linked every headache to an area in the neck. So this was from a 1995 study called the Anatomy and Physiology of a Headache. But there's basically different points that they're connecting every headache to. So like we said, there's a lot of different causes of headaches. It can be due to subluxation. It can be due to toxins. It can be due to
inflammation,
allergies, all that. But there's also a link to an area in the neck.
Right. And a lot of times when you think with a headache, it's coming from your head, but they've linked it to the neck.
Yeah.
Yeah.
So this is another study that talks about the impact of spinal manipulation on migraine pain and disability. So it's a review of a lot of different studies that have been done. But when we talk about spinal manipulation, that's chiropractic adjustments, bringing those subluxated vertebrae back into alignment. So what they found in this review was that spinal manipulation and chiropractic care had a greater impact on reducing the number of migraine days compared to controls with overall large effect sizes. So the manipulation really did bring down the number of migraine days. Spinal manipulation was associated with significant reduction in migraine days compared to control groups. And results from this meta-analysis suggest that spinal manipulation may reduce both migraine days and the pain and intensity of migraines. So that's some hope for those of you who struggle with migraines, because migraines are no fun.
No.
And
it takes you out.
It really does take you out. Yeah, it affects your whole life. So if you can find something that works, you're going to be a happy camper. And then this other study, integrating chiropractic care into the treatment of migraine headaches in a tertiary care hospital. So this is a case series that took a look at several different migraine patients and did a case study with them after doing chiropractic care. And it says that migraines can be managed, but there's no cure, and many medications used to treat migraines have disabling side effects. So how many of you out there that have headaches or migraines just, pop an Aleve or an Advil or an ibuprofen when you get a really bad headache because you don't know what else to do? Well, this is saying, that's not a cure, and those are things that create disabling side effects down the road. So what can actually really help? So there was a case study of a 34-year-old female with daily migraines for 12 years. She was at 7 to 8 out of 10 pain intensity with those migraines every day. And multiple medications she tried provided limited relief. So after 9 months of chiropractic care, her headaches were reduced to 10 per month, with an average pain rating of 3 out of 10. And then at 10 months, she actually experienced her first headache-free month. Now, I gotta say, if that was me, I would be on cloud nine.
Yes.
Like, that is a huge life transformation.
You can live your life.
Yeah, you can live your life. First headache-free month. That's amazing. So they did 3 different case studies, and from those, integrating neurological and chiropractic care for the treatment of the migraines, they found an improvement in pain scores. They found an increase in pain-free days. They found decreased medication usage, and the patient reported decreased anxiety and dysthymia.
I don't know what dysthymia is.
I don't know. But that's what the case study found.
We'll be looking it up.
So those are some really cool studies that give us some good hope about an actual solution. So how can we test for nervous system dysfunction?
Well, this is what we do at the office. We do range of motion tests. We do palpation. Palpation means to feel, touch. We just go in there and we touch the area that you have pain. We palpate your muscles and seeing how tight, spasm, and tender they are. We palpate your capsules between your, which is the joints between your vertebra. Scans. Sometimes we send people off for MRI scans. X-rays, of course, are amazing. Thermography we don't use. Posture evaluation is very, very important. Looking at, your shoulder height, if your head leans to the left or the right, which then by taking X-rays, we will will correlate from, looking at your posture will correlate usually with X-rays as well. So this is a person with a really straight neck.
Yes, very straight neck.
Straight neck. They don't have a curve.
No curve.
No curve.
Curve is very important. You want to have a healthy neck curve.
Yes.
Yes. And like we said, we see a lot of people with their texting neck. We're moving forward, and so many people have lost important curvature in the neck. So we give everybody both care and home care, in office treatment and at home, to restore the curve in the neck. So
posture predicts longevity and mortality. So this has definitely been a study that was done, and spine and posture affects and moderates every physiological function from breathing to nervous system function. And despite the considerable evidence that posture affects physiology and function, the significant influence of posture on health is not addressed by most physicians. And we have another quote somewhere, and I wish I could read it, about how it takes, your years of your life, diminish the more your head is forward.
Yes, it's crazy. We actually, if you go to our website and go to the research tab and you look at our postural research, you'll find that study that basically says that your life expectancy is diminished with poor posture. So it's so huge and so important, but a lot of times
it's kind of boring.
Yeah.
Some people think that posture's boring.
Yeah.
I don't.
It's amazing.
But it's amazing.
Yeah, and you feel so much better when you change your posture. Like, I just noticed, like, in my own posture restoration, like when I'm exercising, when I'm working out, it's like everything just feels like it's right. Like, it's in the right placement. I can move, I can stand, I feel strong. It's amazing what it does, how much you feel better.
Yes.
Yeah.
And I think as we do get older, our muscles of extension have a tendency to be tired and get kind of lazy.
Yeah.
And so definitely the older that we get, I really feel like chiropractic is even more important.
Yeah.
Because it just keeps you from, like this gentleman here with that forward head. I mean, he just looks old.
Yeah.
He looks old.
Yeah.
He looks old and unhappy. Yeah.
Yeah. So I think there's importance for chiropractic both at that older age and also at the younger age in terms of prevention, because so many of us think like, oh, if I'm not really hurting right now, then I'm good. But we see, I mean, even our friend yesterday that was in town, it's like these little symptoms that are starting to show up, and they don't realize what's actually going on in terms of their posture and their disc function. And we're like, oh my gosh, if you can catch this now and get it treated, you will save yourself so much pain, so much headache, so many surgeries and things down the road that are just like gonna keep getting worse and worse and worse. So the sooner you can find these, you notice the symptom and find a solution, get to a doctor that can help you find the underlying cause and fix it now before it gets to be a really big issue in your life. Symptoms are not normal. They're meant to show us that there's an underlying issue and get our attention.
Yes.
So this is the success rate for conventional management for stress and, for any type of ailment that people have. A lot of times they'll go to, conventional doctor and medicine, but what is really the success rate of that? Well, these articles show that, 44,000 to 98,000 Americans actually die every year due to medical error. I mean, we love the medical system. It is so important and so vital, but also it's not perfect. And if we can keep ourselves from having to go and do these more extreme surgeries and more extreme procedures, that is good, because there's definitely risk involved. The benefits that U.S. healthcare currently delivers may not outweigh the harm that it impairs. So that's from exploring the harmful effects of healthcare. And then the incidence of serious and fatal adverse drug reactions in U.S. hospitals was found to be extremely high. So there's definitely, that route going that way has its risks. And so we find that when people can come in and find natural solutions and prevention to the symptoms, they're way better off in the long run.
I just want to say one thing too about, we were talking about ibuprofen and Advil.
Mm-hmm.
Those medications can help, and I think that they need to be used in very respectfully,
Mm-hmm.
because they can really mess up your gut
Yeah.
if they're used prolonged or in large amounts. And I think that is one thing that I think that we get so used to taking them when we have a headache,
Yeah.
that we don't realize what we're doing internally.
Yeah.
And so there is a situation where you're using something to pretty much just cover up what's going on and not fixing it. And then at the same time, then you're adding another problem by taking them by, it causes gut bleeding.
Yeah.
And it hurts your kidneys too.
Yeah.
So it's just something to consider and think about, and really be aware if you are taking, over the counter non-steroidal inflammatory drugs like that.
Mm-hmm.
Just to be careful.
Yeah. And I mean, there's also another study out that says that it raises your risk of heart attack and heart disease. So like pretty actually significantly by like every time you're taking it. So I think that's really important to recognize, like, let's really keep the use of those to a minimum as much as possible and find the cause. This is a cool story. One of our patients, Melissa Galpin, she had an amazing story. She came to Health and Balance. This was a while back in June of 2010. She had severe migraines, visual disturbances. She had extreme pressure in her neck and shoulders and the back of her head. So a family doctor could only prescribe her medications like migraine medications, Vicodin and muscle relaxers. And then Dr. Gary and the Health and Balance staff here gave her care to relieve her pain. But her migraines kind of continued to persist for a little while. So Dr. Gary recommended she goes deeper and have an MRI. They discovered 4 bulging discs in her neck, and she immediately began doing our non-surgical spinal rehabilitation system, which is spinal decompression and the care that we do here for disc cases. And she has actually been pain and migraine free ever since she did all that care. So that story is pretty amazing.
That's a great story.
Yeah, super cool. So we want to offer you guys, a solution if you are experiencing headaches or migraines, and these are affecting your life. I want you to kind of tap into how is that affecting your life? What is that causing for you? What could that be doing for you in the long run? And also, how's it affecting your life right now? When you go to work, are you getting headaches every day? How's that affecting, your quality of your work, your actual experience of your work day, and how much you can get done? And how is that affecting your relationships? What is that doing, in your relationships with family, significant others, friends? Are you not able to give as much and to focus and invest in as much because of the pain that you're experiencing? So really, I mean, it's about our quality of life and what we really value. And what do you value? Do you value your health? Do you value that quality of life? And if you do, then, it's really, we encourage you, get to the bottom of what's causing these headaches. Because I mean, we've seen so many patients that have headaches and have gone so many places and are like, I just have tried everything, but I'm not finding the solution that I'm really looking for. And a lot of times they'll come here and they'll find the solution because we really look to see, like, what is the cause? Let's get to the cause and let's figure it out. So in that, we do a nervous system and spine evaluation along with a headache evaluation to take a look at, any foods that are could be contributing to the problem, maybe hormone imbalances that are contributing, and then, like the research has shown, what areas in the neck are contributing to your headaches, and then the nervous system as well, and any subluxation or postural distortions that you have. So this is actually doing this whole exam is over $500 value, but because you joined us on our webinar today, we're doing it for you for 97. So if you call us at 949-497-2553, just let them know that you were on the headache webinar today and that you want to do this headache evaluation to take a look at your headache, your symptoms, and what's causing them, and we'll give you, recommendations for a solution for how to move forward. So that's our gift to you for being on the webinar today. So like we said, you can just call 949-497-2553 and let them know that you were on the webinar and you want to get your questions answered and find a solution for your headaches. We'll take a look at all those things. So do you have anything that you want to add? Anything that you feel would be helpful for people as we finish up?
Well, I just want to say that thanks for joining us. And, headaches are really not fun. Mm-hmm. And I really think that people that have had car accidents, that's a real contributing factor. So if anybody out there is suffering from, headaches and you've had a significant car accident, that could be your reason right there.
Yes.
And there's a lot of scar tissue in there. And that, one of the things that we do is we do ART and we do Graston, mm-hmm. which are two techniques that we do in the office, and they're super effective in breaking down scar tissue. And then, as Maria said, what we do is we give you home care. Mm-hmm. And between breaking down, that scar tissue and you doing home care, it's so very effective and it's so good. Mm-hmm. And also, if anybody has any questions.
Yeah, if you have any questions, I'm going to actually unmute you guys. If you want to ask any questions, you can either ask out loud or type it in. For those of you who are on Facebook with us, you could type in the little comment box. And for those on Zoom, you can just ask out loud or type it into the question section here. We want to get all your questions answered and make sure we're giving you all the info that you're looking for. And yeah, we're just super stoked that you guys have joined us and hopped on, and hope that you've gleaned a lot of really good information, both things that you can start implementing right now on your own, and then also, some tools for moving forward. Come in, get an evaluation, and see how you can move forward, because we want you to just be experiencing the most flourishing life and doing the things that you really want to do, and having that
Absolutely.
Quality of life restored to you. So we will be doing these webinars most likely weekly at this point. We're going to be just focusing on different conditions, and then doing these webinars with different tools that you can use to implement into your lifestyle to recover from those, and then just giving you really good information, good research that has been found to really help with that certain condition. So we want you guys to get the information that you're looking for, and we would just want to be a resource for you guys, because these doctors have so much knowledge from over 30 years of treating patients and being in this community and seeing so many lives turned around. So they are a wealth of knowledge, and my goal is to just bring them to you so that you can glean all the good information from them and from their experience, and incorporate all the things that you need to live your healthiest life. So does anybody on Facebook here have any questions or comments? Does anybody have Zoom comments, questions before we wrap up? Like I said, our number is 949-497-2553. So you can always call us with questions. And then we'd love for you guys to come in. So take advantage of our webinar special today, $97 to come in and do your headache evaluation. Thank you, Hannah. We are so stoked that you joined us as well, and so glad that you gleaned some good info today. Thanks, Randy, for joining us, everybody on Facebook, and we'll see you guys next time. So hop on, keep your eyes out. Oh, good, Sue. So glad that it was important and that you got some good info. Next time, if you join us on Zoom, you'll be able to see the PowerPoint as well. But we'll be sending it out via email as well, so that you guys can rewatch, and the PowerPoint will be all on the recording that's emailed out to everyone. If you're not on our email list, go ahead and email us, front@healthinbalance.com. That's FRONT@healthinbalance.com. inbalance.com. Just email us and say, hey, I want to get on your email list. That way you'll get all of our updates about our webinars that are coming up, our events coming up. You'll get our daily, weekly tips, and you'll have all that good info. So you guys, happy Monday. Have a wonderful week. We'll see you guys soon. We'll see you on our next condition webinar. Thank you, Dr. Lisa.
Thank you, Maria, Arthur.
Such good info.
Bye.
She's the best. All right, see you next time. See you guys.
Good job.
Good job.